So as Alex and Rhea said, there's often a yin and a yang. The following gentleman is the marketing and sales and business guy at a very successful group called Assurance Healthcare, and he's here to share about building a marketing plan. Please welcome Jason Larsen.
Thanks. Well, so I think our story is probably similar to a lot of DPC practices. We, of course, thought that we were going to be different because my father-in-law is the physician, and he ended up writing his own contract in his old hospital-based family practice clinic. And in writing that contract, he knew not to put in a compete clause and where he knew that his patients were his own. So as we were in our planning meetings, getting ready to open, he actually decided to take the leap, completely go out of his old practice, and then go into 100% DPC. In those planning meetings, I remember him coming into those and saying, this is like shooting fish in a barrel. Everybody loves what I'm doing. He was seeing about 40, 45 patients a day, and about half of them were really excited about what he was doing. And then we were also excited because somehow he finagled all of the names and addresses and phone numbers of his 3,500 patients. So from his business manager, he just asked him for it and said, hey, can I have all the names and addresses of my patients? The business manager gave them up to him. So we had 3,500, it was maybe even 4,000 patients we ended up sifting through. We ended up sending out letters. So this was our marketing plan, right? So he was talking to all of his patients in the months coming up to us transitioning into DPC. We opened January 1, 2014, so he had about 6 months where he was talking to his patients to invite them. So he was talking to his patients. We were going to send out a letter of about 3,000 letters inviting them to come along with us. And then I had owned my own website and marketing business at the time, so we were going to build this killer website, do some great search engine optimization, and that was going to be good to go. That was our marketing plan. Well, we opened January 1, 2014 with 150 members. A couple months into it, we ended up with 300, but then we kind of plateaued. So we had the typical around 10% join our practice and realized, okay, we actually need to do some marketing here. We need to figure this out. So we failed a lot along the way. What I'm going to share with you today is kind of some principles that we figured out have worked really well, and I'm borrowing a lot from some other people that I've learned from. So, but first I'm going to give you a little picture of who we are. So we're Assurance Healthcare and Counseling Center. This is Dr. Richard Edgley, MD. He's my father-in-law. My sister-in-law is the other co-founder. There's 3 of us. She's the licensed mental health counselor. We decided from the beginning that we wanted to do counseling, and it's worked brilliantly. It's been a lot of fun. And then there's me, that does all the business side and plunging toilets and all that fun stuff. Our staff right now, we have 7 total. So right now we have 2 physicians, we have 1 mental health counselor, we have 3 office staff that are assistants. And so 1 is reception, and then we have 2 office assistants, and then there's 1 of me, which is, they call me CEO, but we're a small business. So we're in Yakima, Washington. It's Central Washington State. And this is all just to give you some context of, I don't know where you're at, but I'm going to share some numbers with you. So we have about 92,000 within our city limits, our population of 92,000. The greater Yakima Valley is around 250,000, and that they all funnel into Yakima. There's a lot that work there, a lot come into business, a lot come into shop. So we pull from about this 250,000 population as far as our marketing efforts. We're the only DPC clinic within about 75 miles. And we have wonderful beer and hops and wine, so if anybody wants to come visit, we're looking for another physician. This was our growth. So we joined Hint in August of 2015, and that's where we kind of plateaued around the 350 to 400 range. And then now we're approaching around 1,200 members. That's where we are. The above, the kind of light blue up there is our employer groups. We're starting to get more and more employer groups, and we actually have some quite larger ones joining us this fall. Our marketing has been going quite well with employer groups finally. Okay, so let's talk about marketing. Before you start, the most important thing you're going to do to help your marketing efforts, we've already talked about it, is perfect your member experience. Everything from the sign up, from them signing up, to them staying in your clinic, to the phone calls that you're receiving from them, to even cancellation. Perfect that experience, because that is what is going to help your word of mouth marketing. You're going to end up not even having to ask them to talk to their friends and family about you, because their experience is so great, they're not going to help but talk about you. I'm locked up here. Oh, it's because I'm pressing the laser. Boop, boop. Okay, so here's the 3-step formula that has worked for us. 1, profile your ideal member. So think about who is going to be your ideal member, and let's be specific about this. So give them a name, give them a story. What is their story like? Here's an example. So you really want to think in detail about this. This is who we think about when we market, at least for a while. Now we kind of have different. You could do this several times, but one, we're marketing to Angela. Angela is married to John. She has 2 kids. They have 2 kids together, Alex and Max. One is in elementary school, one is pre-elementary, so probably goes to childcare or preschool. Angela works part-time, her husband works full-time. He has decent benefits, they think, but it's a high deductible health plan. She has had issues getting in the doctors before. They're worried that, if their kids have something wrong with them, it's a week or 2 at least to get into their primary care physician. They want to avoid the emergency room. That's their story. So come up with your ideal member and give them a full story. 2, you want to clarify your message to them. Now, a lot of what I'm going to talk about here can be found with Donald Miller and StoryBrand. Brilliant marketing information, marketing stuff. So when you think about clarifying your message to that ideal member, you are not the hero. This comes directly from StoryBrand. You are the hero in a lot of ways, in your own life, in the medical community. You guys are doing wonderful things, but with Angela and her family, you're not their hero. You're not going to rescue them from anything. What they need you to be a guide, because they're the hero of their story. They want to see their lives succeed. You need to come into their life as a guide. As you think about working your message to them, you want to guide them along. You don't want to share about an instance of this as maybe on your about page on your website. You don't want to talk about the history of what you've done. You want to think about them and what their story is and how their story works into yours. I could probably talk for an hour on this, but here's how it works. So you want to make that message simple too, okay? As simple as you can, make it clear. Try not to get kitschy. They need to be able to read whatever they're reading, whether it's a brochure, your website, if it's a radio message or a TV ad, anything, it needs to be absolutely clear exactly what you do. Okay, so here's our example this is our website. So this is us marketing to Angela, because Angela is the decision maker when it comes to marketing. We just say it's like having a doctor in the family. She needs quick access to a physician. And then we say membership, family medicine, and counseling services. Membership starts at $95 monthly. So they understand exactly what we're about. I'm sorry, but direct primary care is not a common term amongst everybody, so we don't use it yet. Once people become a member with us, we do use it. But in our marketing, we don't use the words direct primary care because it takes too much explanation. So that's how we've interpreted it for our website. Okay, this is number 3. You want to design your membership sales funnel, okay? Or your membership funnel, it's sales funnel. I don't like sales funnel, it sounds too salesy. But so at the top you have your lead generation. So this is where people haven't heard about you, but they're hearing about you for the first time, right? So this is places like radio, Facebook ads, search engine optimization, so they're searching for you on your website. A Google business page, your newspaper ads, Google ads, there's all kinds of things where you can do lead generation, okay? This is where your message needs to be absolutely clear, is in this lead generation phase. Next we have where you're capturing those leads, right? So this is mostly going to be your website. It's also going to be your phone calls. So this is where you need to train your front office staff how to respond to, hey, I heard about you guys do membership medicine. What is that all about? They're interested, right? You might have an email list that you're building. It might be through Facebook. There's different ways, but this is where you're going to be capturing those leads. Then this is the big part of DPC that we have found that is missing from most, quote, sales funnels, is this education piece. Because there's a big gap between them just reading about you on a website. They have a million questions before they actually join your practice. How are you going to educate them in what you do and how it works with their insurance and how it works overall with healthcare? So this can be through seminars. I've heard a lot of people do these town hall meetings, Chamber of Commerce meetings, webinars, could be videos on your website. There's a lot of ways to do this. And then you have membership. So then they're going to join. This is a call to action. Hey, join us. Here's the sign-up process. That's how it works. And then lastly, don't forget this, you want to work into it your retention. This is your member experience. How are you going to retain those members along the way? So here's what's worked for us initially. So our lead generation, actually radio has worked well for us. We've put it in the correct category of saying this is actually just generating leads and funneling people to our website. It's actually worked quite well. And then some search engine optimization. Basically, these are what has worked for us. Capturing website is the big thing. Phone calls and training staff is another. And then we use an email list a little bit. Education, what has worked for us most has been seminars. So we invite people to a seminar Fridays at noon during the hot season, which is between October and December. We end up doing it every Friday at noon because that's when we're really actively marketing, when individuals are thinking about insurance. So that's worked well. And then we also have some videos on our website where they can learn more. Then you have the call to action of membership. Our retention mostly has just been delivering on what we promise, right? Actually having them get access to same-day appointments, helpful and friendly staff, and overall different experience. Okay, so, and then you can rinse and repeat this. So this is one for our ideal member. I have one of these for a small employer. I profile a small employer, I profile a medium-sized employer, I profile maybe a Medicare-aged patient. You're going to have one of these for each kind of different patient. You're going to profile them, you're going to clarify the message to them, and then you're going to design your membership, your sales funnel around them. Okay? So here's some resources. relichealth.com. This is just my way. I'm not a physician. I don't get to help patients. So I feel like my calling is kind of helping physicians do what they do best and help patients. I'd love to see DPC flourish. So go ahead and relichealth.com/hint. That'll have this slideshow on there, and then some other resources like the story brand and some other things. You can email me directly. And then there's the, I would highly recommend these two things. Storybrand.com, this is Donald Miller and his marketing stuff, and then 5-minute marketingmakeover.com. That's it, thanks.